We're really busy in general practice, and it's so hard to keep on top of all the latest evidence, the latest guides, the latest services, and also to know how we're doing as a team.
The general practice teams are bombarded with lots of information. There's so much hitting you from guides, different initiatives and templates, and this space can feel really quite overwhelming.
So Clinical Effectiveness South East London is a team of local GPs, analysts, facilitators, and we understand the local primary care landscape. And what we aim to do is take some of that heavy lifting out of things for the GP teams. And we have the strapline, which is making the right thing to do, the easy thing to do. And our overall aim is to drive up quality and reduce unwarranted variation.
So in clinical effectiveness, we are evidence-based, both for the clinical management, and we are also introducing evidence-based behaviour change methodology into our educational events.
So we agree with practice teams what clinical areas to focus on. And at the moment we're working on type 2 diabetes and we're working on hypertension. We then pull together all the information we think a GP team needs into an accessible guide. So it's just got the key information. This will include evidence on management, but also local pathways, local referrals, local support both for clinicians and for patients. These are available online, they're localised to each borough, and we adapt them and update them when we need to.
So a really important part of embedding our guides is socialising them through educational events. We also ensure that clinical templates on systems that practices used are aligned to our guides, and that's really important because it provides you with all the prompts that you need when you have a patient in front of you to provide the best care. It can also signpost you to local services for patients, so it takes out that element of having to find where all your local services are, and really importantly, it helps us to correct data accurately by encouraging correct coding. We also have two fantastic analysts in our team who produce data packs, and these are shared either at a practice level or at a PCN level, whatever a borough prefers. And these really help to locate the areas of improvement a practice wants to focus on, and then it helps our team to support them through that improvement and change.
I'm Linda Drake. I'm one of the diabetes practice nurses at Elm Lodge Surgery in South Southwark. So the data packs were new to us this year, and we found them very helpful in terms of deciding which patients we would use to bring to the clinics. In the past, we'd tended to do searches which had revealed those patients with very poor diabetic control, and we always got the same names, patients who were extremely reluctant to engage. This year, the data pack searched for Elm Lodge Surgery in those patients that were engaged, but that still identified areas within their diabetes care where there was scope for improvement. Hello, Rosalind. Thank you very much for coming along this afternoon.
Yeah.
It's been a while since we last saw you.
It has.
The searches we've been doing have produced some data packs which have shown us the names of patients where their diabetes control could be improved to help reduce their risk of complications in the future.
So our clinical effectiveness model is based on the East London Clinical Effectiveness Group model, which has been running for about 20 years and has had some best-in-class results both nationally and internationally across a range of long-term conditions in some very deprived parts of London. We scaled their model to a couple of South East London boroughs in the first instance, and again saw some similar results. We were most improved in one borough in QOF, which is the Quality and Outcome Framework in London, and across two boroughs saw great results in the National Diabetes Audit, with significant improvement within a few years for diabetes control measures.
We're optimistic in the next 24 to 36 months that we'll be able to demonstrate positive change in patient health outcomes. For year 2 and beyond, we are working across South East London in all the boroughs with on-the-ground teams to co-develop priorities that work best for practices and therefore their individual patient populations.